Ladies and gentlemen, today I'll talk about improving access to the crop protection tool, Tumaini, which is used for managing banana pests and diseases. Work that has been done in collaboration between the Rwanda Agricultural Board and 2 universities in Benin, and also the CGIAR Plant Health Initiative. That is the gender cross-cutting work. In our outline, I will talk about artificial intelligence tools, then introduce banana bunch disease, which we're using as a model for this study, and then look at some gender dimensions in disease management before going down to access to AI tools, and then looking at farmer appreciation of Tumaini tool, and then knowledge and disease linked with gender disparities in among the producers. Development in information technology has led to a lot of advances. And so many tools have come to fore, both for modeling, observation, and also machine learning. And these are found uses in very many areas, security, research, but also in agriculture, where we could use them for risk forecasting, for risk modeling, for yield forecasting, for risk modeling, and also in this case that we'll talk about today, pest and disease monitoring. So what we'll talk about today is a tool that uses smartphones to observe pest and disease signs and then classify them to make decision support for farmers. We have 2 examples of those tools recently developed within the CG family. The first one at the top is Tumaini, which will be the subject of our discussion today. And then at the bottom, we have an earlier one that came out of IITA, and that is the Nuru app for detection of banana diseases. For detection of cassava. Now, then we'll also talk about interaction of these with the gender aspects, because gender disparities exist in agriculture. They exist in agriculture because agriculture takes the form, defines some gender norms or gender roles that then will define the participation of different players, different members of the household in agricultural and income generating activities. They define their participation in livelihood strategies, and they may also define their capacity to build networks within and outside of the community. This is a little bit different from just the identification of sex of being either male or female, but you see that that alignment then will define what a female or male is expected to do in a particular community. And then within there, we also have individuals that are of one sex, but have to encompass lacking a member of the opposite sex in the household, have to then straddle the roles of the 2 sexes in the household. So they have more gender roles. These roles also determine ownership of property, and they also may define some limitations that the farmers have in performing their roles in a community. They may define opportunities offered to individuals, and arguably, both men and women are crucial for food security and income security. But gender roles play at social levels, at society levels anyway. Then when we talk about the management of vector-borne diseases, especially management of invasive diseases, these diseases spread between farmers at landscape scale. So their management should recognize landscape scale action, and so no individual will be left behind, and that makes it very important to address gender disparities and social disparities in disease management possibilities, because weakness in one garden is a weakness in the entire risk in the entire landscape. So when we look at the tools, let us look at how do we optimize access to tools and management so that we can reduce disease at landscape scale. Also for this study has been banana bunch disease. But first, If you move across different areas where banana and plantain are cultivated, you will be encountered with different forms in which it is consumed that will be transformed or ripened. And these define the economic priorities that the farmers put in banana and plantain production. For the sake of this presentation, I will use the word banana to include plantain. The banana bunch top disease is an invasive disease that is coming into the continent somewhere, sub-Saharan Africa, somewhere from around 1958, 1961. And it is transmitted by the vector aphids that would then move between plant and plant. And if the first plant was infected, they can transmit it to the second plant. But they are also transmitted through seed systems. Inadvertently infected seed would introduce the bunch top disease into a new field from where aphids would take over and transmit it within the landscape. It is fairly easy to recognize the symptoms of the disease. Early symptoms are a little bit more difficult to recognize. First, you have streaks appearing on the leaf petiole and also on the leaf plate. And then eventually you have appearance of yellowing on the leaf. And finally, the plants become stunted and so develop what we usually refer to as the bunchy top symptom. And these plants do not usually produce fruit, but they don't die immediately, and so they end up being a source of infection to them. The status of banana bunchy top disease in Africa, as it is presently, up to 2016, we had banana bunchy top disease already reported in about 16 countries. Though Egypt reported it at the turn of the last century, that introduction seemed to have been controlled. But in sub-Saharan Africa, a spread started in the 1960s, and that has now spread to almost 18 countries now. Togo, Uganda, and Tanzania having recorded the disease only in the last 3 years. This percent of the banana growing countries, or close to almost 80% of the banana growing landscape. Now, previously we had looked at the Tumaini tool as it came out, and we tried to assess its performance if we were challenging it with pictures of different quality. So we had used very, very low-end cameras, only 4 megapixel cameras, and then intermediate 16 megapixel and fairly advanced 48 megapixel cameras or smartphones equipped with these kind of cameras. And we would then subject the same plant, photos of the same plants to the Tumaini tool, and then assess the level at which the tool was able to diagnose banana bunchy top disease. Was that the tool was very versatile. So intermediate and fairly good cameras had very similar levels of performance. But then the lower end cameras needed a lot more pictures to be taken before diagnosis could be reached. And they were also more affected by lighting conditions that would naturally affect the farmer photographing conditions in the garden. So we asked our question. The lower end cameras are either to be the older cameras or the cheaper ones. How would these perform then in the hands of the farmers? Who owns which kind of cameras? Would this provide or present a significant social disparity? And if that would be the case, then what options would be there to try and mitigate these kind of disparities so that landscape, the more experience one had, the better they were able to detect the disease in comparison with the experts and in comparison with. Now, but later on in this presentation, I will let you look again at the comparison between the experts and the novice farmers or farmers with varying levels of experience on disease detection across the disease symptom expression range. So the context of our study is we would like to find out if the AI tool would represent significant social disparities between men and women, and also between different kinds of men and different kinds of women in a community. Then we assess the performance of the tool on telephones with different capacity and under different photographic conditions. We studied the ability to support, of the tool to support farmer training by learning and comparing with what they could identify by eye. And then we compare the output. We compare these outputs with access to mobile phone devices, because this tool would necessarily require mobile phone of some kind. We then discuss some improvements that the developers of the tool could use in making this later. I must point out that last week a new version has emerged, and what we are presenting here is based on the tool that was existing previously. We have not tested the latest version. So in our study, we had training sessions, we had testing and information sharing, both in focus group discussions and collecting on-farm experience. And then we also gave pre-training and post-training exams to the farmers so that we could compare their performance before and after they were exposed to the tool. So complete novice and barely trained farmers. And then we carried out demonstrations on the field. So first, access to smartphones and therefore access to the tool. In both Benin and Rwanda on the left, access to smartphones was barely between 20 and 30%. It was better in the communities we studied in Benin, but all the cases, men had better access to smartphones than women had. About 20% of women in Benin in the production zones that we studied had access to smartphones, while about 35% of men had access to smartphones. Rwanda was much lower, 10% of females or less, and just about 20 to 25% of men in the areas. Basically, we had low accessibility to tools that could be used to engage with Tumaini, and even the tools available had generally low capacity, and the women tended to have older phones that were also lower in performance. And in Rwanda, in total, although 80% on average of the farmers had phones, most of these phones were not smartphones. So asked about, after exposure to the tool, some of the impediments they had, there were aspects that were quite common in the different areas. Language that we are using in the tool and to give instructions after diagnosis, literacy in manipulation of the tool that seems to improve over time, and clear-cut interpretation of results were some of the issues that were raised by the farmers. There was also capacity of devices that they were using. But then when we looked at the women and the men separately, in some cases, involvement in banana production would determine the interest in adoption of the tool, or even access to mobile phones, or social limits linked to production of banana. So we see that there are issues that are linked to ownership of property, that are linked to production segmentation of the different products, but we also see that there are issues that are linked to technology itself. And then other issues that are linked to either the cost of production or that are linked to supporting issues like network capacities and also electricity. As one of the farmers, a female participant in Ruzizi said, men asked who had access to better phones. He said it's men that had access to better phones because they are the head of their families, and so they are the first to get smartphones. Their phones would then be inherited by the women when they were upgrading. But if their phones had problems, they would revert back to take the women's phones. And to them, this was a normal behavior of men. So we tried to ask, what about resource control, which had emerged as one of the issues? what makes women not participate in banana production? Here in dark, we have responses from men. In light, we have responses from women. And you can clearly see that where men have opinions about women's access, their opinions tend to be negative. And women also seem to have some sort of opinion of the men. So there is a context in resource control. But both of the groups agree that women tend to participate in multiple income generating activities, that control of resources is an issue that determines who participates in which activity. We then asked, were there advantages that they could see after the initial training and testing the tool? Were there issues that they could see were positive about the use of the tool? And yes, with smartphones, there was, if someone in the landscape was able to do diagnosis, then there will be ease in interaction and ease in support. The tool was fairly easy to use, and that would relieve extension agents or local experts in having to support. They also felt that such tools would give them assurance in terms of diagnosis and would make them more autonomous and fast. However, if you look, the women tended to link bank more towards assurance, autonomy, and speed, while the men tended to bank more of ease to use and relief of the support, mechanism in helping them diagnose the disease. So you can see that there are different objectives in, or different difficulties, slightly different difficulties in disease management by the different groups. Now, the developers of Tumaini tool have developed, in response to earlier observations, an offline and an online capacity. And the offline capacity was still in development. So we did try to compare how the two are performing, because that would immediately solve the problem of network access, which had emerged as a big problem. And here we compare what the percentage that the expert determines as healthy and which the online tool determines as positive, as healthy, and also what the offline tools determines as positive, as healthy. Now, the remaining fraction could either be misidentified as sick or where there is no response given. So, encircled in green, we have what we can call the reliable identification or true diagnosis that can support the disease management. And then not cycle would represent areas where there will be difficulty and alternative support would be required. And we see that there's a slight disparity between the online and the offline tool. And the offline tool seems to have lower performance in determining or diagnosing the disease. Our take-home message here is the offline tool we know may require that the farmers have a large database in their phones, but we see that if that could be nicely selected and as effective, that would really increase the appeal for the use of this. Then we went down, tested in Rwanda issues of language that the farmers had highlighted before. Rwanda is formerly an Anglophone country, having moved from being Francophone in the last 2 or 3 decades. But what we see is that a large majority of the farmers are actually monolingual, only able to read and write the local Kinyarwanda language. The English and French and Swahili, which are the locally spoken languages available in the tool, are barely used by the farmers that we contact. So language is an issue that could be a low-hanging fruit that could be sorted by the local agricultural boards and which could be integrated into the tool if this tool was to be widely adapted and used in these languages. And we think that in Benin, the local language form would also open up the use of the tool because that is spoken mostly in the southern language. So Benin is much more linguistically advanced, linguistically diverse compared to Rwanda, which is monolingual. The Kinyarwanda is spoken by nearly everybody, or in Burundi, Kirundi, which is also almost spoken by everybody. And the advantage here is that the two languages are very, very similar. So opening up Kinyarwanda would probably already benefit 70% or so the needs of Burundi. Now, we created a social support system around the tool. WhatsApp group for farmers, one for men and one for women, where we would plant in questions and try to engage discussions to see to what extent the farmers would be able to respond to support requirements in these WhatsApp groups. And the farmers were also allowed to post whatever diagnosis they had made during a particular period. And we followed this over 1 year. We are still following it. Now, the results I show are up to December last year, 2023. And we see that, yes, after the training around November 2022, there was quite a bit of activity up to April, where the activity dipped for both men and women, and then it picked up again in August. And when we superimpose the probability of rainfall, that is rainfall patterns in Benin, we see that other intervening factors could determine whether farmers were trying to use the tool to diagnose banana diseases in their own area. For example, the rainy season represents the peak seasons for agricultural activities, including banana and plantain, but also different other crops. And so we see a dip at that time. Now, what that tells us is that if we were to look at the activity level in using the tool, then we need to consider the competing roles of the different groups, which could be in agriculture or not. Now, in this slide, we are showing a training session and also an assessment of the farmer understanding of the disease. So the results on the right, on the graph on the right, show 3 locations. On the left, we have the area around Kigali City, Gasabo. In the middle, we have the area on the extreme west of Rwanda or northwest of Rwanda, bordering Kivu Lake, and that borders Congo. And then on the right, we have the area around Rusizi, southern Rwanda, which was the part that had first reported bunchit disease over 2 decades ago. Straight away, we see that the area that has had the disease for longer, they were better able to diagnose the different stages of disease, whether they were early symptoms or the middle, intermediate symptoms or the late symptoms. But we also see that late symptoms are quite obvious, quite easy to detect for most of the people. But even then, we see that in some areas, lack of a bunch is not clearly identified with the disease in areas that only recently got the disease. And that is the same as stunted and dwarfing and stunted fruit that are sometimes thought to be fertility problems. We also see that the later symptoms are easier than the earlier symptoms. But we want to point out that controlling bunchit disease after the results we got in Malawi some 4 years ago was that the capacity to detect these early symptoms or capacity to find the plants that have these early symptoms and remove them was sufficient to reduce the disease and manage production over a period of over 3 years among smallholders. So the key is in letting farmers aware of these early symptoms. Now, and some of the views we got from the farmers: requirement for internet, which is costly and not stable. Difficulty and the capacity of smartphones emerged as one of the issues, especially that the women had, and trouble adopting, that made it difficult for them to adopt the tool after we pulled out the little support for airtime that we had given during the study. And also the right to banana production, which was generally controlled being a cash crop, so it was more controlled by men. In Rwanda, especially, land sizes are quite small, and so there isn't sufficient areas where the farms would not be shared, and also not sufficient areas for women for their own commercial production. And for the men, language emerged, the capacity of the phones emerged again, and also internet connection. So one suggestion was about literacy, if it was possible to have pictograms or training in color-coded messages that would allow them to quickly and better understand traffic lights. So what we are seeing is that the technology development shortcomings would have contributed to some of the gender disparities that we see. I had asked colleagues that were involved in testing the tool, and most of the phone models that have been used to develop and test the tool were fairly high range, at least 18 megapixels. It will be interesting to see what happens with the lower end phones that are still in circulation, though these are disappearing now. The offline support tool, as I've said, will be a real game changer for areas where the network is not very stable. Some language inclusion would be very important, and social learning and support groups is something we can exploit to increase access to such AI tools. What to do after banana biting disease has been found in the landscape? Our tool is more capable of finding the fairly late symptoms. So the sequence of activities towards detecting the initial symptoms in a landscape, the risk reduction protocol for landscapes would be important. And so other issues are involving control of resources that we do not have technology solution. This work was supported by the Plant Health Initiative, Work Package 5 and Work Package 3 collaboration. Work Package 5 is cross-cutting. It was standing off the shoulder of an earlier project funded by the Gates Foundation through University of Queensland. And we thank the Rwanda Agricultural Board and the universities of Ketu, Abome Kalavi, and University of Rwanda that were implicated in this study. We also thank the farmer groups that collaborated during this study. Thank you very much, and thank you, Nozomi, for supporting this work. Thank you.